Good morning, Dr. Lucas. How are you?
Good morning, a little wet.
Yes, all right. Good to have you in here this morning. We were wondering at first.
Laura was going to do the show.
Yeah, that's
I
right.
wasn't
That's
here.
right. All right, let's talk a little bit about. Obviously, we talked about diabetes here too, and diabetes awareness, right? That's a month, and
Yes, this is the month to be aware of diabetes, not to get diabetes.
that's right. That's right. But we want to talk about that because leading into the holidays, it's a big thing, you know.
It's a big thing. Maybe that's why it's in November.
Yeah, that's right. Okay, so what are we talking about today?
So I think for the next 3 sessions, we'll probably talk about if you know you're going to be at risk for diabetes, which we talked a little bit about last time, what are you going to do about it? Because you'd rather not get diabetes. I mean, I don't think there's anybody that wants to get diabetes.
Right.
It's a big pain. So it'd be better not to get it. So that's what we're going to talk about. There's different ways of not getting it. There's diet, exercise, and medicine. And so we'll start with diet.
Well, now, again, we talk about risk factors and genetic factors, etc. Some people feel it's inevitable they're going to get it.
Yeah, that's what I was told when I first moved here, that diabetes was so common, it was a way of life, and just accept it and go on and not worry about it. But it's not inevitable. I know genetics play a large role in everything you do. And it could be that that your parents didn't know they had diabetes when they were raising you, so you got raised in the wrong way and eating the wrong food and not exercising. But there's always a way of fixing it.
Okay, well, let's talk about some of those ways now. Where do we get started with that?
So what you want to do is, if you're at risk for diabetes and you have a large amount of fat around your waist or your belly, people keep saying, it's not my waist. I'm like, okay, belly
Close
fat.
enough. Yeah, right.
Well, when I measure them around their belly, they say, that's not my waist. That's not where I wear my pants. So it's not where you wear your pants if you wear them low. It's pretty much around, I would say around your belly button, but as you get older, your belly button sags, so it's a little bit higher. So it's pretty much the biggest measurement in between your rib cage and your hips. Is your belly. And the reason we measure that is not to embarrass you or anything. It's just if you have a lot of belly fat, then you're more at risk to get a lot of things, not just diabetes, but high blood pressure, heart disease, high cholesterol, high triglycerides. Even cancer is more associated with belly fat, some kinds of cancer. So that's why I want to get rid of the belly fat. It's inside your body, not necessarily outside. So doing sit-ups does not help the abdominal fat that's inside your body. It doesn't make it go away. So we'll talk about exercise another time. But what you want to do is get rid of the belly fat. You want to have...
So you got to set a goal, right?
Yeah, well, your goal should be, if you measure it, women need to have less than 35 inches. And men need to have less than 40 inches. So men get a little bit of an advantage there. But you want to aim for that. It doesn't really matter what your weight is, it matter where your fat is. So if you measure your waist, and it's really not waist-hip measurement anymore, it's pretty much waist. We don't care where your hips are. Hips don't cause medical problems. Well, I don't know. They can cause arthritis, but,
So
any kind
hips
of
do
extra
lie,
weight.
Okay. All right. So let's...
Extra weight causes all kinds of problems, but the
So-
belly fat needs to be decreased.
So it's not necessarily associated with a weight goal, but that's going to be a common thing for people to think
Yes, I think people want to have a weight that's reasonable for them. Probably not high school weight, because everybody somehow was skinny in high school.
Right.
But maybe your adult weight, what you feel comfortable at, what you wear, your clothes well. But as we get older, the belly fat accumulates, and I think not having the belly fat really puts you at risk for a lot of things. So that's why we need to get that down. So your weight, whatever your weight is fine. I mean, go ahead and put your goal weight down in reasonable quantities as far as what goal you want to get to. I wouldn't say I want to lose 100 pounds in a month, because that's really unrealistic.
Right.
You aim for 1 to 2 pounds per week if you're aiming for a weight goal. The inches goal, you want to put how many inches you want to lose, but usually that's easier fat to lose. Hip fat is hard to lose, thigh fat is hard to lose for women. Men just think about losing weight and they lose weight, so that's why women are all upset with them, usually. So, the food is important. We all have to have food. That's why it's hard to go on a diet compared to quitting smoking, because smoking, you can quit and you don't have to have it for life. But food, you have to eat. So if you think about what insulin does, insulin is the only hormone that lowers the blood sugar in the whole body. There's 5 hormones that raise the blood sugar. Insulin's the only one that lowers it. And what happens with the pancreas is it has to make a lot of insulin to overcome your genetic defects. So the genetic defects are insulin resistance and a signaling problem to the pancreas. So those are the two genetic defects you want to overcome. So you don't want to stress out your pancreas by eating a lot of things that you need insulin for. And most people don't understand that. You need insulin. You make insulin in response to only certain foods. So fruits, starches, and milks. So those are the groups. If you eat protein, if you eat fats, if you eat non-starchy vegetables, you really don't need insulin for those. Those are taken care of other ways. But you do need them. And especially sugar, refined sugar, really makes you need a lot of insulin. Fruit juice makes your pancreas really have to put out a lot of insulin. Makes your sugar higher. If you don't have diabetes yet, and that's what we're talking about, people without diabetes, then you want to keep from getting diabetes. You don't want to stress your pancreas out and burn it out. And as your pancreas dies off, then you get diabetes. So you want to keep your pancreas working longer by not eating a lot of food that makes your pancreas make insulin.
So fresh fruit is something you have to take in moderation.
Fresh fruit, depending on the fruit. So apples, which have a lot of fiber and delay the absorption of the sugar, are going to be better than bananas, which are all sugar and no fiber. If you eat a banana with a meal or with peanut butter or something else with it, you delay the absorption. So if you delay the absorption, the pancreas doesn't have to work as hard. If you drink fruit juice or sugared drinks, any kind of sugared drinks, you're just going to wear it out quicker. So just quit the sweet tea. I don't understand why people drink that, but I guess I used to drink it too. I was forced to drink it when I was younger. I grew up with it, but it's all sugar, and it makes your pancreas really have to work hard very quickly. It has to work hard, so you really don't need to drink a lot of sugary drinks. That's probably the worst thing you can do. Cereal and things that are in liquid or turn into liquid pretty quickly stress out your pancreas. So if you eat cereal and orange juice for breakfast, then you need to really change what you're eating to try not to stress out your pancreas. Plus you get hungry in 2 hours anyway if you do that, because your blood sugar starts dropping. After it goes high, then it drops low, and then you get hungry again. So you get hungry all day if you eat that kind of breakfast. So breakfast is probably the hardest meal to get right. So what you want to stay with is you want to stay with protein every meal. You want to limit the number of calories, maybe 500 per meal, but you want to spread it out. You don't want to have all your calories at night. And some people do that. They don't feel hungry in the morning, so they wait till lunch. They're a little bit hungry by lunch, but then they really don't eat much at lunch. And then
is that the idea of spreading it out like to 6 times a day? Or?
No, I don't believe in eating all day. I think that's a bad idea if you have problems with your blood sugar, unless you go too long without eating. If you have a big gap, like say you eat breakfast at 5 a.m. and you don't have lunch till 12, then you're going to need some kind of snack, around 9 o'clock to even out your blood sugars. That's fine. But the diets that give you 6 small meals a day, I just think people eat too much. They eat all day.
They tend to cheat on each of those 6 meals.
Well, and if you're making insulin every time you eat, I guess it depends on what you eat. But there's a tendency to overeat and overeat calories if you eat multiple times a day. So I don't advocate that at all. I advocate the 3 meals, but breakfast is an important meal too.
Okay, all right. We'll talk about lunch in a moment. We did breakfast. Let's do lunch next. And Doc, you said right before the break that we talk about breakfast and lunch, but you said you wanted to talk a little bit about what to actually have for breakfast.
Okay, so if you want to eat protein for breakfast. Yogurt is not protein. Yogurt is milk, and it's a sugar.
Not even Greek yogurt?
No, that's not enough protein to mask the other part.
Okay.
And that's more mushy. Any kind of thing you eat mushy, you chew up. Like if you eat a piece of toast, you turn it into sugar. So what you want to eat mainly is eggs. Eggs for breakfast is the best. Cottage cheese. You can put fruit with the cottage cheese. And you don't have to eat breakfast food for breakfast. I mean, a lot of people get fixated on waffles and pancakes.
Not those of us who get up early in the morning. We don't.
Donuts.
We eat anything. All right. Again,
so leftovers are good.
Find out more from beachdoctor.com, more about diabetes and endocrinology consultants.